Svjetska zdravstvena organizacija nakon pandemije covida priprema poseban nacrt globalnog sporazuma kojemu je svrha brže suzbijanje budućih infekcija i pravednija distribucija cjepiva, lijekova i zaštitne opreme. Kako se Hrvatska nosila s epidemijom, tema istraživanja i američkog znanstvenika Jamesa Leduca. S njim je u klinici za infektivne bolesti dr. Fran Mihaljević razgovarala Zrinka Grancarić.
Good day and welcome to Croatian Television Primetime News.
Thank you.
So you're here on a Fulbright scholarship. You're working on a study how Croatia handled the COVID crisis. What is the focus of your survey?
Well, I've been very fortunate to work with some of the Croatian public health officials, the medical community, and some of the national leadership to really review the pandemic, how the response occurred, and the actions that were taken. And the goal is to try and capture lessons learned, what should be retained, what were the mistakes that we made, and how to improve those.
Well, the measures and the actions were a part of an ongoing dispute in Croatia. So in your opinion, what worked well and what didn't work well?
Well, I think many things worked very well. And it really starts with the all-of-government approach. You were very fortunate that you had consistent messaging from the very top, from the Prime Minister all the way through to medical leadership, and they all had the same message. Now that message changed over time because we knew more and more about the pandemic. But the point is that there was consistent, accurate messaging given every day, and sometimes many times a day going forward. So that was an important point as well.
Mm-hmm. Medical-wise?
Medical-wise, I think the community did a very good job in recognizing early on the severity of the disease, the need for isolation wards and for especially ICU facilities. So they rapidly changed the existing infrastructure to allow to manage these patients, which was really a huge, huge job, but it worked quite well, I think. Mm-hmm. When there was a crisis in the fall of 2020, when there was a surge in cases, the community then modified so that they actually created additional hospital beds in the Arena Hospital, in tents near Dubrava Hospital, all of which helped to move patients, release the demand on the hospitalized patients, and allowed the facilities to move patients that were on the road to recovery into less demanding environment.
Going to the part that didn't work well, what do you think?
Well, the entire world was facing this new challenge, and the communications was difficult from the very beginning, and over time it became more and more difficult, especially as the population in general was frustrated and more groups began to criticize those that were making decisions. So I think the communications challenges were very significant, and we need to work on doing that better.
Well, in your opinion, what are the key messages we should bear in mind for the future?
Well, I think preparedness is an important aspect, and I think having this facility here that focuses on infectious diseases engages the country internationally so that you know what's going on around the world. So when the next pandemic occurs, you have an advanced warning. The fact
next pandemic.
There will
How
be
high
one.
is the possibility?
I think the possibility is great. The question is when, not if, because I do think that there will be other issues, for sure.
Well, World Health Organization is working on a big global pandemic treaty. How difficult will it be to reach an agreement?
I think it will be very challenging because there's, 194 separate countries. Getting them to agree on a treaty may be a challenge. That said, I think everybody has been at risk of this pandemic. They all are aware of the need for better international coordination. So there's a will to make something happen. But I'm cautiously optimistic.
Mm-hmm. Going back to the COVID vaccine, do you think it fulfilled its purpose?
Absolutely. The data is very, very strong, especially if you have pre-existing conditions like you're older, you're overweight, you have hypertension, you have diabetes. These are conditions that exist very prominently here in Croatia. You have an old population. The vaccine doesn't prevent infection, but it does prevent serious disease. And the numbers are very, very clear. So I think the vaccine has done its job. The challenge is to get people to take the vaccine, and that goes back to the communications challenges.
Well, the virus is obviously here to stay. We know that for a fact.
Yes.
Are we sure that it's not going to go wild again?
No, in fact, I think we need to be monitoring it. We've seen evolution take place in front of our very eyes as each of these new variants emerges, and they modify the virus itself enough to overcome or evade the immunity that's existed by the vaccine. That will continue to occur. So we need to be vigilant. We need to be monitoring the virus itself, and we need to be making new vaccines as needed to adjust to the evolution of the virus.
Thank you for your time. Thank you for your thoughts, and enjoy your stay in Croatia further.
Thank you. It's been my pleasure.
Thank you.